Hello everyone and welcome back to the Diary of an Endodontist. Today we'll be talking about treatment planning. Stay with me. So, what is the best treatment plan when a patient comes to you with this crown, long post, marginal leakage, a bit of swelling and pain? Would you consider retreating that tooth yourself? Would you refer that tooth? Or would you consider the extraction? Let's all agree that extraction is always an option, and let's not rush into it yet. Assuming this tooth is not cracked and that there is a possibility that this tooth is absolutely fine just with residual bacteria, retreatment, orthogrid retreatment will be the way to go. What would you do? Would you do that yourself? So if so, you must consider two things. So first of all, have you got the knowledge and equipment to do that? And can you do a better root canal treatment once you are there inside of the tooth? We remove the crown, you remove the post, and you are there to retreat that tooth. Can you do a better job? If your answer is no, stop there and just refer the case, because it will be very stressful and you end up not achieved success. But if you think you can do that, so jump into it because it will work. Just go for it, enjoy your challenge, and it won't be easy, I must say, but definitely worth it. In this particular case, because it had coronal leakage, I decided to change the crown. Once I was there, I removed the post and I saw that there was not enough toothy structure, so I decided to put a new post. If there was no coronal leakage, I would probably have chosen to do endodontic microsurgery and go via buccal bone, remove it, ape-sac the roots, and then retrofill the roots. It's not easy as well. It's quite complex surgery, mainly on this tooth, but I would say it's quite conservative if you think that you have to remove the post and there is a risk that you end up fracturing the root for some particular reasons. So yeah, it's worth considering the retrograde retreatment as well if you have the skills for that. I hope you have enjoyed this case and don't forget to watch the other ones. See you soon.